public health educator at MaineGeneral Medical Center. This presentation will cover basic information regarding hepatitis A. So, hepatitis is an inflammation of the liver. When the liver does too much work, it begins to swell and block its usual jobs. When the liver is unable to perform its job, the body begins to lose ability to do normal things. For example, the symptoms of hepatitis include tiredness, fever, joint pain, yellowing of the eyes or skin, weight loss, and dark urine or light-colored stool. There are 5 main types of viral hepatitis: hepatitis A, B, C, D, and E. We don't hear a lot about hepatitis D and E because those are 2 types that are quite uncommon in the United States and are more common in underdeveloped countries that have poor sanitation. The 3 common strains of hepatitis in the United States are A, B, and C. This presentation will cover hepatitis A. So, hepatitis A impacts the liver. What does the liver do? The liver has 3 big jobs. It filters, stores nutrients, and produces chemicals. The human body can't work when the liver doesn't work. How is hepatitis A spread? What particles spread hepatitis A from person to person? Hepatitis A is spread by feces, like hand-to-mouth contact after using a restroom and not washing your hands, or hand-to-mouth contact when using a cigarette after using a restroom. For example, if someone with hepatitis A uses the bathroom and doesn't wash their hands after, they may have tiny particles of feces on their hands that aren't visible to the human eye. If this person then goes outside and they have a cigarette, they touch the cigarette and get these hepatitis A tiny particles onto the cigarette. If they share that cigarette with someone, the other person could touch the hepatitis A particles with their mouth, and it could infect them into their body without knowing it. This is how hepatitis A can be transmitted. There is a vaccine for hepatitis A, which explains why the rates of hepatitis A have declined by 95% since 1995. However, as seen on the graph, there have been spikes or outbreaks of hepatitis A, which includes slight incline in the past couple of years. Because the vaccine was invented around 2000, not everyone has the hepatitis A vaccine from birth or childhood, like hepatitis B. Hepatitis A is not as common as other types of hepatitis. The state of Maine typically has less than 10 cases of hepatitis A per year. Hepatitis A is a short-term illness, meaning the symptoms typically last less than 2 weeks and the virus typically clears someone's system in less than 6 months. This can happen without any treatment at all. Most people who have hepatitis A recover to full health without any long-term liver damage. However, hepatitis A can be severe and can result in liver failure. There are approximately 100 deaths per year in the United States as a result of hepatitis A. Those that are most at risk for long-term hepatitis A complications are people with liver diseases or people who are over the age of 60. So, what behaviors increase your risk of getting hepatitis A in the first place? All of the above. Sharing cigarettes, not washing your hands after using the bathroom, traveling to other countries, and using injection drugs can all increase your risk of getting hepatitis A. It does not mean that if you do these things, you will get hepatitis A, but doing these things can transmit hepatitis A from person to person. As we've seen, there are several behaviors that place a person at greater risk for getting hepatitis A, including, but not limited to, the ones on the screen. These are all the behaviors where someone would be in close contact with someone who has hepatitis A, and there might be an unhygienic hand-to-mouth contact with infected feces. So there has been an increase in hepatitis A cases in Maine over the past decade, unfortunately. Specifically, there have been small outbreaks already in 2020. There have been 7 cases in the first quarter of the year, when there are usually only 1 case per quarter. We've been hearing that more cases of hepatitis A are found in communities where people use drugs, so it's very important to use clean injection drug equipment and use clean supplies that are sterile or thoroughly washed before sharing or using. There are a few different ways to prevent getting hepatitis A and giving hepatitis A to others. For example, washing your hands after every time you use the bathroom and disinfecting surfaces in bathrooms. Those are 2 ways to improve hygiene. If you are at risk for getting hepatitis A, you can talk to your healthcare provider about getting vaccinated against hepatitis A. Additionally, if you have used injection drugs, there are local needle exchanges that will give you free, clean supplies For every used needle you bring in, they will give you one free one. There is no limit for the number of needles you can bring in to get free ones back. There are also supplies like alcohol wipes, sterile waters, and sterile cottons for cleaning and preparing drugs. For more information on the Augusta area or Waterville area needle exchange, please call 872-4102.